Hello everyone, once again welcome to my Oet channel. Today I came with one roleplay explanation. So this is a question came on 25 January 2025. So we will see the cue card and the explanation. We'll go to the video. Now we can see the case note scenario. That's a hospital ward, and the nurse scenario is you see a patient who has just undergone knee surgery and is due to be discharged. You see the patient to discuss their discharge and answer any questions. So first of all, you have to know the scenario or the setting. It is a hospital ward. You know the patient's name, but it's not mandatory that the resident or the patient knowing about you. So in the introduction itself, you are going to greet the patient with name. So during 3 minutes preparation time, you have to ask the patient or interlocutor how may I address you during the role play. Example, if the patient's name is George, just write name on your cue card. So it will be helpful if there are two patients like mother and baby, like a parent or relative or someone with you. So you have to ask both of their names and just mention patient's name in small letter and the relative's name in caps lock. So it is easy because you are going to talk with the resident. Most of the time, you will address the patient's name only one or two. But in this situation, you are going to talk with the patient. So only one name and you can write it like either small letter or caps lock. Then you can see that the first task is confirm the patient's readiness for discharge. You are going to confirm the patient that, or you are giving the information that he or she is getting discharged today. So what is the reason? His post-operative recovery is satisfactory. Then next thing you are going to ask whether patient knows about pain management, mobility, self-care after discharge. Find out the patient has any concern about these areas. So that is the first task. So how we can going to start? So during 3 minutes preparation time, you got resident or patient's name is George. So now we can start like that. Good morning, George. I'm Rishmi, one of the staff nurses working in this hospital ward. How are you doing after surgery? So this is general introduction or general greeting. Then you are going to start the task. So the answer might be, good morning, sister. I am keeping fine. Thank you. Then the question is, George, actually, I would like to tell you something regarding your discharge package and discharge process and everything. Before going further, I would like to tell you that your post-operative recovery is satisfactory and your doctor is discharging you soon. And I would like to ask you that, do you have any concern regarding the pain management, mobility, and self-care after discharge? If you have any concern, I am here to help you. So that is the first task. The second task is outline common temporary after effects of knee surgery, swelling, stiffness, bruising, discomfort when walking, etc. And give details of recommended pain relief, prescribed painkillers, over-the-counter options like paracetamol, etc. So that means you are going to give complete information regarding the post-operative management. So what would be the answer? So it's up to the interlocutor, okay? The answer from the interlocutor is not predictable, but at least we can just imagine. I like sister, I'm not confident enough to self-care myself, but it would be better if you could advise some of the tips. So that is the answer, means you can proceed with the second task. Like you can tell that, no worry, Josh, I'm going to give you some informations how you can manage yourself after discharge. I would like to tell you that it's a common thing that you may experience few after effects after the knee surgery, like a swelling, stiffness on your surgical part, bruising, discomfort when walking. But no need to worry, these all are temporary after effects of the surgery. It will fade or it will subside as time goes. No need to worry about that. And if you have pain, I will give you some details of the pain relief. You can take your painkillers as prescribed by the doctor from here, or over the counters like paracetamol tablet. These everything will relieve your pain. Are you getting my point? So with that, we can conclude there. So the third task is advice on mobility expectations using crutches or a walker, gradual weight bearing as advised by the doctor, provide guidance on leg elevation and easing to manage swelling. Then either you can ask, do you have any other concern, or else you can just continue. If you ask, do you have any concern? So the most probable questions, sister, I am so much concerned about my mobility. So how it would be? Or else you can just start the conversation. George, I would like to give you some advice on mobility expectations. Of course, after knee surgery, soon after the discharge, you can start using crutches or a walker because you will have the difficulty to walk by your own. Gradually, you can bear the weight as advised by your doctor or physiotherapist. Gradually, you can walk without any assistive devices. Then, along with that, I would like to give some guidance regarding the leg elevation and icing of the surgical part to manage swelling. If you start walking, of course, there might be pain or swelling or some other discomfort. So to prevent those discomforts, please elevate your leg after a few steps walking, or you can keep ice packs on your affected part to manage further swelling and pain. Are you getting my point, or are you okay with that, or how does that sound? So like that we can ask the questions. The next task is recommend exercises for recovery, like gentle knee movement, physiotherapy exercises as instructed, advise on avoiding high impact activities and heavy lifting for the recommended period. That we can ask, do you have any other concern, or we can just inform George regarding your exercises. I will give you some tips and advices. So for easy recovery, please do gentle knee movement daily, and a physiotherapist will instruct you some exercises and you can follow those exercises without any fail. Please try to avoid high impact activities and heavy lifting for the recommended period of time, because if you have activities like high impact activities, or if you lift very heavy objects, it might cause pressure on your affected part, like surgical part, and it may cause some complications. So please try to continue your physiotherapist advices. I hope you got the point, isn't it? So like that you can ask. The next thing is advice on wound care to prevent infection. Like keep the surgical site clean and dry, watch for signs of infection like redness, warm, or discharge, and explore any other patient concern, next steps, return to work, etc. Then this is a lengthy conversation, so in between you have to ask, you have to encourage the patient to ask question like, do you have any concern, or do you want me to ask any questions, is there any other concerns, like that you have to ask them. Okay, so you should not keep on answering everything. It will be like a one-way conversation. So you have to ask the patient to query, like you can ask any queries or concerns or doubts or whatever the thing. The next thing is, George, example, if the patient asked, sister, I have concern about my wound care because I stay alone, then you can tell that, Mr. George, I can truly understand your concern. No need to worry. I will help you and I will advise you on wound care. So wound care after surgery is very much important to prevent infection. Please keep the surgical site clean and dry always. Please watch for any signs of infection like redness, increased temperature like warm, or any discharge or oozing from the surgical site. If you see any type of these symptoms, please consult the doctor as early as possible. And if you have any concern, so here they have given that explore any other patient concern like next steps or return to work. So you can ask question, George, do you have any concern regarding the next procedures of discharge or post-operative steps or return to work or anything? So of course they may ask about the follow-ups and when they can return to work. So our next task is the same answer. Confirm any necessary follow-up appointments, stress and need for medical help if the patient develops severe symptoms like fever, excessive swelling, uncontrolled pain, signs of infection, etc. So you can tell that. So we will give you discharge pack in which every information will be given, like a wound care, exercises, rest, food, medications, your follow-up visits, physiotherapy exercises, and your when you can return to work, etc. And in addition, I would like to tell you that please attend your all follow-up appointments as instructed in the pack, and please get medical help as early as possible if you develop any severe symptoms like a fever, excessive swelling on the affected part, uncontrolled pain, or if there is any signs of infection, which I mentioned earlier. So please don't wait for anything. As early as possible, you can get emergency help, or you can return back to the hospital in the emergency department as early as possible. Did you get my point? Or how does that sound? Or are you okay with that? So like that we can ask. So every conversation should end with one reinforcement, or you can just tell that, Mr. George, do you have any more concern? You have to ask that question anymore. So you can, or else you can tell that, I hope I have explained everything. Do you have any more concerns? So if the answer is, if no, sister, I got every points and I am really thankful for your explanation. So you can conclude like this. Okay, Mr. George, I hope you have gained enough knowledge regarding your post-operative care. And if you need any help anytime, please do not hesitate to contact with our contact number. We are here to help you anytime. And of course, I will give you the discharge pack, so it will be helpful for you to maintain everything on time. And if you don't have any other questions or queries, can I proceed, or may I proceed with your discharge process? So this is the conclusion of every discharge explanations. The cue card with the discharge explanation. If you don't have any other questions or queries, may I proceed with your discharge process? Okay, so like that you can conclude the role play. So I hope this role play explanation is helpful for you. So you can present in your own way, but just make sure that the patient's name already asked in 3 minutes preparation time, and you have to convince them, you have to reassure them, you have to ask them, do you have any concern? You have to explain everything clearly, and in the conclusion you have to ask them, do you have any more concern? And the end you have to tell that, if you don't have any other question, may I proceed with your discharge process, remaining everything as in your way, how you are practiced is the same way. There will not be any changes. Few steps or few tips are what all I mentioned here. So keep it in your mind, those tips, and you can keep practicing. When you start practicing, don't set time for the practicing. If you're nearing exam, so you have to set time like 5 minutes and you have to practice it. Okay, so when you are practicing in the earlier stage, don't keep time. You have to take your own time to make the sentences. You have to make sentences clearly. It can make 10 minutes or 15 minutes even if you are a starter or if you're a fresher. But gradually you have to reduce the time of presentation, and at the end you can, when you are confident enough to talk freely, you can set 5 minutes and you can start practicing. So you can practice in such way and it will be helpful. And we have online academy. If you want to join for any modules, you can just contact in the given number, which is in the description, and we are here to help you. There will be classes in your flexible time. We can arrange if you are in India, Middle East, or in European countries. We have enough tutors to handle those students in their convenient time, according to the convenient time zone. And there are no time limitations for attending the classes. In case if you join for 15 sections, so there is no time limit that you have to finish your classes within 15 days or 1 month or 2 months. You can discuss with your tutor and you can extend. If you want to get the guides for writing, speaking, it's available in India. If you are in India, or if any of your friends are in India, we could send to them through the courier. And the details also, it is attached in the end of the video and even in the description also. So you can contact in that WhatsApp number. We will give you further informations. I hope this video is helpful for you. We'll see another one informative video. Until then, bye. Take care.